mula sa Asian Community Development Council. Ito ang Fil-Am in Focus. Mondays at 12 noon, right here on PHLV Radio.
Magandang hapon po sa inyong lahat and welcome to Fil-Am in Focus, a program by the Asian Community Development Council wherein we discuss critical issues affecting Fil-Am in the Las Vegas. So, today's episode is about behavioral and mental health in the AAPI community. In the recent years, there has been an increasing acknowledgement of providing care and treatment for people experiencing mental health issues. And according to the National Alliance for Mental Illness, Asian Americans are the least likely ethnic group to receive mental health treatment. So to understand why, our guest speaker for today will help shed some light on the stigmas and challenges surrounding mental health and AAPIs. So joining us today on Fil-Am in Focus is Justine Perez, who is the Clinical Director of Silver State Health Services. So Justine is a fully licensed mental health therapist and clinical social worker with over 10 years experience in the medical, mental health, and social work field. She has worked with a wide range of clients, including outpatient clinics, psychiatric facilities, nonprofit organizations, and private practices. Sobrang galing niya rin, and because Justine graduated magna cum laude from UNLV with a bachelor's degree in social work and received a master's degree in social work from UNR. So, welcome to Fil-Am in Focus, Justine.
Kamusta po?
Mabuti. Ikaw?
Okay naman po. So excited to be here.
Oh, maraming salamat for being here, Justine. So, you have more than 10 years in behavioral work field experience. So, this work is very complex and challenging, but very meaningful work. So, how did you get involved in this field?
So it was really surprising. I never thought I'll be on this field of mental health. Mm-hmm. So actually, I started as a certified nursing assistant. Mm-hmm. And I worked for years as nursing assistant. However, I work a lot with people with mental health issues. So when I was working as a CNA, I actually work a lot with individuals with dementia. And I work with a lot of caregivers that time. So during that time, I was working nursing assistant. I feel na my hands are tied. I cannot help a lot. Gusto ko talagang tumulong. So I was like, I need to go back to school. I need to really go back to school to pursue something. So I was thinking, how can I help these people further? And that's how I landed working with social work. So they said social work, you work a lot of social policy, social welfare. And I'm interested with that. Then later on, I was pulled to mental health. So what happened is when I was working as a CNA, I talk a lot with the patients to the point, that's not really my job. I just keep talking. Even when I went to nursing school, I get in trouble because, I talk so much to the patients, like to the point I cannot just give medication or follow the doctor's order. So, I get in trouble because of that. So that's the time I realized I need to go in a different field. And I saw the need too. Working in medical field, working in rehab, working in skilled nursing facility, I saw almost everybody that I worked before, they have some mental health issues. And, for me, I was like, how can I help? Like, how can I be a solution to these issues in our community? So, that's what happened. I went back to school to get my master's, then later on get my postgraduate experience as a clinical, intern. Then later on, become therapist.
I see. Pero nung nag-migrate ka dito noong 2009.
2009. So as soon as 2009, I actually it's been really a difficult transition in here. So like I mentioned earlier, when I was starting here in America, I actually went to CNA school. So CNA. So a lot of people know nursing, like certified nursing assistant, they're actually helping seniors or people with disability to take a shower, all of those stuff. So I really started, on those jobs. So, so when we immigrated here, that's my first job. I actually can remember I went to CSN and asked them like, hey, how can I start here in America? I just graduated from the Philippines. How can I start? And they gave me this paper saying, this is the classes for CNA class. It's just actually just one semester. So since for us, we don't have money, so I was like, this is probably a great start. I don't want to work in retail. I don't want to work in another field. So I was like, I'll just start here. My plan before is just to actually work a lot as a CNA. And help my parents. Actually, we got here in America. We didn't have anything. We don't have any house, but we have family members who actually supported us in here. So gradually, just keep working as a CNA. Then during that time, I just really saw hey, this is the field I want to work in, and and later on, the doors just opened up. For us, for me and my family members,
So mula doon, habang nag-aaral ka, nagtatrabaho ka rin. Wow.
So it's really difficult. I actually had 3 jobs in one time, working at the same time, having a full-time job in order just to make things work. For me, one of my goals in dumating kami dito is, to have a own house. In the Philippines, we never own our own house. So that's my goal, is to actually give a house for my family, to my parents.
Ang galing mo naman at na-accomplish mo lahat yon habang nagtatrabaho at nag-aaral din at yung na-achieve mo sa eskwelahan at pati na rin sa iyong trabaho. Ang galing, yung hard work mo. At dahil nakita mo yung need na yon, dun ka naging involved sa field of behavioral health and mental health. And the terms behavioral health and mental health are used interchangeably.
Definitely.
So can you explain the differences para mas maintindihan namin?
Actually, there's not a lot of changes. Like you said, it's interchangeably. You can use it either or. Because in mental health, in mental health issues, you actually will actually encounter behavioral health issues too. And behavioral health, it really involves mental health. So you can use it, interchangeably.
I see. So behavioral health or mental health encompasses promoting health and well-being of the mind, body, and even spirit.
That's right.
But also is the continuum of illness prevention.
Definitely.
Treatment and you would say recovery support services.
Yes.
I see.
Yeah.
Okay. And according to the National Alliance on Mental Illness, or NAMI, compared to those of other racial ethnic backgrounds, Asian Americans are least likely to receive mental health treatment. Only 20.8 of Asian adults with a mental illness received treatment in 2020. So what are the stigmas that should or shroud mental illness in people of AAPI descent?
So for us, Asian American Pacific Islander, a lot of us think about, uy, nakakahiya naman to, nakakahiya naman. So we always have that mindset, that if our family members are seeking mental health issue, it's really severe. We always think, oh, baliw na siya. Oh, nasisiraan siya ng ulo. So we always use the term in our household to the point it actually affect, of us seeking help. And, for us, Asian population, in our Asian culture, we are actually always focused on what others thinks about us. we're always big on that. We always think, ano kayang sasabihin ng tita mo? Anong sasabihin ng kapitbahay natin? O pagchichismisan tayo. So we always have that mindset. So a lot of Asian American Pacific Islander, they have that. They always have that hiya. So it's just really difficult to actually seek help. And at the same time too, for us, in the Philippines, we grew up with less or actually almost nothing in terms of resources in mental health.
Yes.
So, we're not educated a lot about it. So that's why hindi natin alam na yung mental health is like just your physical health. You need to actually take care of that too. So, pag sinabi pong, oh, may diabetes ka, I'm just gonna take insulin, and there's no hiya. Hindi ka naman hihiya na nag-insulin ka. And it's the same with the mind. When you have something going on, like for example, if you're having depression symptoms, you can actually take some medication too. And sometimes it's not forever. It's like a clutch na gagamitin mo. But there are some mental health issues where kailangan mo talaga ng lifelong treatments. So, it's just like, when you're getting medication for, diabetes or, heart disease. So it's just the same.
Kailangan lang siya ma-normalize.
Yes, kailangan natin ma-normalize. That it's just the same. You're taking care of your body, you need to take care of your mind too.
Yes.
Because, it's all interconnected.
You mentioned it a while ago that discussing mental health concerns is still considered taboo in Asian cultures. And actually, in the recently held National Empowerment Conference by the National Federation of Filipino American Associations, there was a plenary session on mental health. In the Filipino American culture, a community that least likely to seek mental health treatment services more likely to drop out of treatment compared to other Asian American subgroups. Why do you think so? Bakit kaya?
Yeah, so actually I noticed that too. They will seek help, but later on they're not compliant to medication or they're not compliant with therapy because they're still like hiya. A lot of people I work with, they're not even sharing that to their family members that they're seeking help. So, most likely if you're hiding it, of course, you don't want others to know. So the compliance, for mental health treatment is not really good. So because of that, nandun pa rin yung hiya. So kunwari, you're taking medication for anxiety or depression. A lot of people I know or people I work with, they hide that from their family members, especially kung parents nila. So they will just take medication. But the thing is, it's like you still have that hiya. It's like, I don't want to do this anymore. Or, for example, like if you feel like you're doing great, magaling na ako. Hindi na ako magme-medication. Because of the stigma still, it's always just looming on the back of our brain that it's in there, na nakakahiya.
Oo nga, tama ka dyan. Kasi it was further discussed then that hiya or shame or having difficulty seeking help is due to that. And then, not only that, yung come what may or bahala na. Or even yung amor proprio, meaning self-esteem.
That's right.
So those are the yung mga Filipino cultural trait that yung hinders people who are experiencing mental health issues from seeking help.
Yeah, I agree with that. I like when you said bahala na kind of mentality. We have that as Filipinos. Ay, bahala na. Uy, bahala na talaga. Gagaling ako. So we always have that. We even have this toxic positivity that, oh yeah, magaling ako. Or, kailangan masaya lang talaga ako. To the point, toxic positivity really affects us too. But you know what? But in terms of mental health issues, kagaya ng physical issues, hindi to kailangan gawing bahala na. We really need to focus on it. Because like, for example, magkasugat ka. And, if you keep saying, bahala na yan, to the point, you just keep putting Band-Aids and not really treating that, hindi gagaling. it will get infected as time goes by.
Right.
And it's just the same as the mental health too. If you keep saying in your mental health, yeah, bahala na yan. Malungkot ako ngayon. Oh, ang dami kong anxiety talaga. You know, some of us will say, bahala na yan, gagaling ako. Okay lang ako. Or, you know, sometimes we will think, oh yeah, you need to pray. You know, it's definitely, you know, good to definitely like pray and think like really, like go to God and really talk to Him about it. Tulungan ka para sa, you know, mga mental health issues. But the thing is, you know, faith without action is always dead. You need to do something about it.
Yes.
Because it's not going anywhere. You know, if you don't treat about it.
Yes. There's nothing wrong with that.
Definitely.
But you, as you said, you have to put action into it. And then not all of us have a strong support system who can help you, and sometimes you have to express yourself too, and some of the barriers also could be yung language.
Yes, that's right.
And speaking of yung language, yung some aren't able to fully express themselves in their or speak their own language. So importante is having those providers who can provide or provide medical advice.
That's right. You know, I agree with that. You need to have really diverse, you know, providers in clinics. You know, there are times that, for example, you know, sometimes you just need to have that person that can understand your culture. So, you know, sometimes, we go to everybody. However, iba talaga, kung pupunta ka sa kakilala mo, Filipino, you know, that they can speak your language at the same time, they can understand the issues that is going on like, especially for your culture. Because, like, really, you know, in realities, each culture really have different issues that we're going through.
Yes.
And for us, like Filipinos, it's definitely good, you know, to go to Filipino providers, you know, to seek help, because they can actually understand what you talk, like understand what you're talking about. They can understand your culture. They can understand your household, and you know, it feels good, you know, to have those kind of providers.
Yeah, so language and representation matters.
Yes, language and definitely representation matters. It doesn't matter like where you go. It just feels so good to actually see like a person in just the same culture. You know, you are more likely to actually seek help when you see someone that, you know, kamukha ko siya, mukhang Pilipino siya. So you're most likely will get help.
Yes. But do we have enough culturally competent medical providers in the behavioral field?
Actually, you know, for behavioral health, we focus on cultural competent. You know, for me, my license is under licensed clinical social worker, and actually, we need to have like continuous education about culture, about, you know, cultural competent, you know, issues. We need to actually study that. And actually even other, you know, mental health providers on other licensure, they have that. They focus on that. However, in reality, it's just a book. You know, some people, they will just keep reading it, but that's it. The thing is, it's good to have, you know, diverse population in your in the place of your employment.
Yes.
Because you will learn more having that instead of, you know, having it in your book or having it in school curriculum. But right now, you know, on behavioral health field, we try to push that. We try to push to be culturally competent.
And it starts in the school system, in our school system.
Definitely. It's our school system, you know, and for us, and you know, where I studied, it's definitely, we focus really on cultural competent. But, you know, talking about mental health though, in our schools, you know, since you mentioned schools already, you know, right now in school system, I think we need to have a lot of mental health, you know, like education.
Yes.
Like it will be great if we can start on elementary talking about when you're sad, how can you regulate emotions? You know, when you are anxious, what are the things you can do? You know, so it's good to have that on our definitely school curriculum.
Yeah, so that's a way for
Yes.
individuals, well, and even in the starting at a young age, how they
Yes.
will be able to manage and
Yep.
control their emotions.
Yep. And you know, right now, you know, just looking back or like just thinking about it, you know, talagang like wala tayo masyadong education in the school. You know, like some people, like some schools, they will talk about it. But how about our Clark County? Do they talk about in school? I never really heard of that. You know, when we educate our kids, our teenagers about how to really manage, like mental health issues. How can we really manage stress? You know, we need more of that. And even in college too, there's not a lot of education about mental health unless kung magme-major ka ng mental health, you will get a lot of those, education. However, I think it should be part of the curriculum.
Yes.
Because we are all getting stressed out. We all have some kind of trauma in the past. And I think it's good to have that in any, in our school system.
Yes. And so nabanggit mo kanina yung hiya or shame, but how is it or why is it important to seek professional mental health support services and overcome the feeling of hiya or shame or losing one's face and really overcome yung negative opinion of other people?
I think it's good to actually seek help right now. When you see the symptoms, you need to actually reach out to someone, because like I said earlier, if you don't really focus on it, it will get worse. But for us, Asian American Pacific Islander, paano tayo magsasik ng help? Paano natin ma-overcome yung hiya? So I think just finding, a Filipino provider will be a great start. You know that you'll be comfortable sharing. You know that that alam nila na yung pinagdadaanan mo. So I think just start in there. Or if right now there's a lot of really we are lacking, Asian therapists. I think right now just start seeking help, talk to your friends about it. Try to be vocal.
Okay.
About it. Sometimes it's good to actually talk to our friends. Like, hey, I'm going through this too. And you'll be surprised. Yung mga kaibigan mo, they're going through the same things too. But but right now, I think that's my advice is actually seek help right now. And if it's possible, try to find, Asian providers who can actually educate you, because it's good. It feels good that, they can speak your language, they know your culture.
Yes.
And I think that, yung hiya is you will less the hiya, because, those providers, they're educated to really deal with those kind of things, those kind of stigma.
So it would be very beneficial for you to not just seek out help to those providers, but actually be very vocal, and then let your family and friends know that you're going through a difficult or a tough time.
Definitely. For us, Filipinos, pag may problema tayo, we actually sweep it under the rug. To the point we're not thinking about it. But the thing is, now, mental health resources are there.
Yes.
Try to access that, and at the same time, for us, let's take it upon ourselves and educate others too about mental health. For me, I try to educate my family as much as possible in terms of mental health, because for us, we don't know. We barely know about mental health, and I think it starts with you. Try to educate yourself first.
Yes. And at Silver State Health Services, where you work as a clinical director, what are the behavioral services that you provide for the patients?
So right now we're providing plethora of services. We got a lot of services. For example, we are providing individual therapy. It's like regular talk therapy. We got some couples counseling. We got family therapy. We got basic skills training and psychosocial rehabilitations. We have those kind of things. And we got peer support also. And in the future too, we're planning to have group therapy.
That's
And
amazing.
at the same time too, we have medication management.
Oh, that's amazing.
So for us, it's as Filipino, it's so difficult to start, taking medication. It's like a taboo. Oh yeah, nasisiraan ka ng bed, inom ka ng gamot. But sometimes you need that. You need that medication. So we're providing medication management too.
So kailangan mo talaga ng professional
Yes,
help
professional
if you're
help.
experiencing
Yep.
that.
And definitely you need professional help. There are times because of sahiya or because of lacking resources, we tend to actually gravitate to those illegal.
Yeah.
You actually go use drugs. And it's really sad. That's why now having more providers who are providing the services is good. Resources are out there.
Yes. And do you still see any challenges in accessing healthcare and insurance?
Yeah, so as a provider, there's a lot of issues that we're going through. First of all, in terms of credentialing, so there's some providers where they don't accept your insurance. You want to see the provider, but hindi sila tumatanggap ng insurance mo. So as a provider, it's difficult sometimes to credential. When we want to provide like Medicaid services, through Medicaid, you need to wait for 6 months to be credentialed as a provider in Nevada Medicaid.
Wow.
And there are times providers are giving up. That's why they don't want to accept insurance anymore.
Oh.
So think about managed care organizations too, like private insurances. Some providers, they will actually try to enroll to become a provider.
Right.
But it still takes a lot of time. And it takes a lot of time and applications in order for you to actually complete those. Like I said, a lot of providers just give up. And what they want is just private pay. So it means that a lot of people cannot access it. They cannot afford it more. So in terms of that, I've been talking about this a lot, even on a state level. I always mention this issue that I'm hoping in the future that the processing for credentialing of providers to provide services for the clients should be easier.
Yeah, but under the Affordable Care Act plan, it requires the plans offered through the health insurance
Yes.
exchange should cover services for mental health
Yes.
and behavioral. And actually, it's one of the essential health benefits that they should be covering. And if you don't have health insurance coverage, we have at ACDC, we have health insurance navigators who could help you find a plan that suits your medical and financial needs. So
That's right.
we have actually Tagalog speakers who can help you find health coverage.
Yeah.
So just email healthcare@acdcnv.org so they can help you with finding who can assist you with your health coverage. So just email again healthcare@acdcnv.org or call 702-489-8866, and we have Joy and Gwen who can assist you with
And
that
I'm
one.
very thankful for ACDC for helping us. Even for me myself, when I was doing private practice, like when you do private practice, wala kang insurance. And for me and my family, we needed help in navigating insurance. And navigating insurance is difficult. And it feels so good that meron kayong providers, meron kayong coordinators na nagtatagalog para mag-assist sa amin, mag-apply ng insurance. Those actually, Health Link, it's really difficult to navigate, at times, and I'm really thankful.
Ay, maraming salamat. At naalala ko yun kasi si Roseanne ang tumulong sa iyo. At yun yung kasi ang mga health insurance term, mahirap talaga siyang maintindihan. And
That's
having
right.
culturally competent health navigators to explain to you, mas maigi mong maintindihan ang mga insurance terms at makakatulong sa iyo to choose the right plan
That's
for
right.
you.
And actually, like, having those coordinators, it's easy for us, to seek help. Like, for example, my parents, like, mahirap, like it's really easier for them to talk to Roseanne during that time na they really need help on doing this. Siguro kung wala yung organization nyo, siguro we just gave up, in terms of, insurance, because it's really difficult, to understand insurance. It doesn't matter if you're a provider or you're a consumer. It can be so difficult,
But that's good to know, and thank you for sharing. And also, likewise, having your organization help with treatment and care for those experiencing mental health issues, and having you as their Tagalog speaking, mas komportable.
Yeah, definitely.
Lalo na sa ating kultura, para hindi mahiya or basta to seek help para makatulong sa kanila. And do you believe ngayon ngayon na normalize na ang issue na ito, mas maraming AAPIs who will seek more help or mental health treatment in the future?
Yep. What I believe that in the future it will be better. Because right now there's signs of hope already. We're in more and more Asian American Pacific Islanders are actually trying to educate themselves about mental health issues, and it makes me proud. That as time goes by, I can see more people, and even in the Philippines, I was really shocked that they even have apps for mental health in the Philippines. So actually knowing that, it's a good sign. That they're actually catching up about mental health. And for immigrants going here in America, they have that knowledge that, it's okay to seek help.
So, yung mga therapy, mga treatment, these are yung mga for, of course, yung mga those experiencing mga severe psychological distress. But what are yung mga preventive measures that you can suggest?
So, there's a lot of preventive measures. First of all, it's always good to support others. If you see someone who's struggling, be there, listen, be a human being. I think that's always the first step. If you see someone like having a hard time, it's good to ask, are you doing okay? And at the same time, for us, if you are actually experiencing some kind of symptoms, mental health symptoms, it's good to reach out. Can be to your friends, can be to like providers. Those are first thing, that can actually help us to prevent that. And, secondly, it's good to actually, just research, it's like, what is this? What are, the symptoms? Paano kaya, what are the things that I can do, to prevent, getting more depressed? There are times that talagang mahirap, makakita ng provider. Sometimes you need to really do your part too. So those are the things that I see that as a prevention. And right now I think just becoming more vocal about mental health. If you actually like learn something, like try to share it to others too. I think as time goes by, I'm hoping that the stigma will be lesser to the point everybody will be vocal talking about it.
And lastly, and just before we close our episode, what is that one piece of advice that you can provide our fellow kababayans?
So one piece of advice for all kababayans is, when you actually feel some kind of like mental health issues, if you feel sad, if you feel like anxious about something, try to seek help. It's better to seek help right now than to wait. Those are the things that I'm actually seeing right now. When you see that, when you feel it, try to seek help, because resources are there, especially right here in America. We need to take advantage that there's a lot of services in here for mental health issues. And another thing too is, wag kayong mahiya. It's okay not to be okay.
Yes. Thank you, Justine. Maraming salamat for being here. And thank you. Maraming salamat po sa inyong lahat. Thank you for listening and watching Fil-Am in Focus, a program by the Asian Community Development Council. So for more information about ACDC, please visit our website at acdcnv.org and follow us on our social media channels. And also, I'd like to invite you to visit the silverstatehealthservices.org, and you can also call them at 702-471-0420. And abangan po ang aming susunod na episode. Hanggat sa muli. Thank you.
Thank you po.
Just like a friend from back home. This is your Filipino radio experience in Las Vegas. PHLV Radio. PHLV Radio. Just like a friend from back home. This is your Filipino radio experience in Las Vegas. PHLV Radio. PHLV Radio.